Welcome back. I'm Tammie Colon with us today from Mental Health Recovery Services. It's Suicide Prevention Awareness Month. We've been talking about some of the factors that go into that suicide rates, and we think about the impact of the pandemic. Did that make things worse because of maybe the isolation of it?
Oh, the pandemic definitely made things worse. You know, prior to that, we had a lot of social upheaval.
Sure.
Then we had the pandemic, so we did have people isolated. We had professionals that were not able to get in contact with individuals who needed them. We didn't have our school systems open to keep eyes on our young people and alert us when they were in trouble. We had businesses closing, so definitely the isolation. And then as a result, we've had a lot of people suffering economically, the loss of jobs, family disruption, and that all contributes.
Yeah, alone with your isolation. Are there certain age groups? We think so much about our kids and what a travesty that is when you lose somebody to suicide. But then you look at the rates as far as the #1 killers of kids, and it's right up there. Suicide's right up there, isn't it?
Yeah, it is with our kids, with our middle-aged folks who have really suffered from the pandemic and the social upheaval. We also know that there are particular occupations that are suffering more. We have, people of color, our farmers and all the suffering that came as a result of that. So we know that there are populations that are at higher risk.
Sure.
And it's not because of who they are, but it's because of the way in which it impacts them in their world. The stigma around getting help, the isolation that many of those professions have, the discrimination that we know still exists in our country, and all of those together for a person who's suffering already can be very difficult to manage.
I'm glad you brought that up, because some of those were transportation, and they would talk about ODOT people, or forestry and fishing and construction. And as you said, those are often stereotype professions where you're a tough guy and you go out there, a tough guy or gal, and go out there and do your job, and to seek help may not be what they always do. Is that our job then to maybe, if we've educated ourselves and know that those are the high-risk populations, maybe keep a closer eye on those folks?
Yeah, and I think any profession in particular that you work in small numbers or in isolation, that you're at a greater risk.
Sure.
You don't have colleagues around you that can recognize behavior changes, mood changes, your attendance at work. People aren't hearing you say things that are alarming. So all of those professions are contributing to the greater risk for those individuals.
I think about people who are introverts too, and they're not big on crowds, and they're not big on talking on social media, that kind of thing. I guess you can't break them of that habit, because some of us to an extent are all like that. But do you keep an eye on those folks too, because they don't like talking with crowds, and they don't like doing these kind of things, and as you said, they might be more at risk.
Yeah, and that's why it's so important for everyone to have a little understanding, right? Family members, coaches, primary care physicians, because you do interface with somebody in your world. Maybe not at a social environment, but there are folks that are a part of your world, and the more of us who know those signs, how to address it, how to make connections to resources if somebody were to suggest that they're at risk, then the more comfortable we are sharing that, and hopefully we can get to all of those people.
Yeah, you said too, you've talked about that education component. That's the key, to know these things that we've talked about. Some of these things I would have never guessed certain occupations were more, or minorities had a higher risk. So I guess we educate ourselves. That's the way to go, right?
Yeah, it's educating on what to look for, and then educating so that you're comfortable intervening.
Sure.
And more importantly, we know particularly among young people, it's never what they did that they live with. It's what they didn't do.
Sure.
Right? Yeah. You do the hindsight, the reflective, the look back, and you go, oh my gosh, I missed that. Oh my gosh, I should have asked more questions. And so the more equipped we can all be so that we don't have to live with those thoughts, and the healthier we all are as a society.
Makes it easier. All right, Tammie, thank you so much. Appreciate it. Don't go away. Medical news coming up next on Noon Edition.